So I'd like to chat with you about the role of Interleukin-2. Interleukin-2 is a therapy that made a big splash when it was introduced for kidney cancer. It was approved by the FDA for this indication back in 1992. Since then, there's been a lot of debate whether or not IL-2 or Interleukin-2 represents the most ideal therapy for patients with metastatic or distantly spread kidney cancer. I'd like to weigh in with my thoughts on this matter. Interleukin-2 is a therapy that comes with certain consequences. It's a drug that is known to cause severe cardiac and lung toxicities. And in terms of the benefit that's yielded by Interleukin-2, if we put 100 patients with kidney cancer that's spread in a room, what we'll see is that about 5 to 7 of those patients in that room, not a huge proportion, are actually going to have a durable, meaning long-term response to Interleukin-2 therapy. So where does Interleukin-2 stand in the context of the new therapies that we have out there now for kidney cancer, the so-called targeted therapies? Well, the targeted therapies have really come into the landscape of kidney cancer therapy from 2005 onwards. What I will say is that we're increasingly recognizing that there might be a population of patients who get these targeted therapies who may have the same durable response that you get with Interleukin-2. In addition to that, what I will say is that if you have that same 100 patients in a room with kidney cancer that's distantly spread or metastatic, it might be closer to 30 to 40 patients in that room who actually have a response to these new targeted therapies. By virtue of this, I tend not to be such a proponent of Interleukin-2 in the first-line setting. Having said that, it's a treatment that still warrants consideration in your discussion with your own medical oncologist if Interleukin-2 is administered. Because of the potential toxicities associated with it, I would certainly recommend that you get it at an experienced center where they're used to administering the drug and have done so in a large number of patients. With all this being said, I would like to refer you to a blog that I recently posted on the Cancer Grace website to learn more about Interleukin-2 therapy and where it fits in the context of currently available agents.